Hello, my name is Ashley Waddell, and I am a Doctor of Physical Therapy student at Rocky Mountain University of Health Professions in Provo, Utah. I was born and raised in Gilbert, Arizona, and I attended the University of Arizona for my bachelor's degree in nutritional science with an emphasis in nutrition. Overall, I've always been a huge advocate for the human body and value movement quality more than anything. My ultimate goal after graduation is to work in an outpatient orthopedic clinic with a specialty in both pelvic health and human performance. My desired patient population is professional dancers, actors, and athletes, as well as patients in need of pelvic floor physical therapy. I've actually previously worked at Spooner Physical Therapy, and I absolutely loved it. I felt that I was able to grow professionally and personally within the field of physical therapy, hence one big reason I want to continue my education as a student physical therapist at Spooner Physical Therapy. I love the Spooner approach to movement because I do feel that if you have a patient move and be physically active, they will feel better within their own skin. At Spooner Physical Therapy, treatment plans are individualized based on the impairments existing within each patient who walks through the door. I think that is pretty special. Getting the opportunity to be a student physical therapist for Spooner Physical Therapy would put my Herman and Wallace pelvic floor level 1 course to use with professionals who excel in not only the function but the dysfunction and treatments of the female pelvic floor. So the dates of my clinical rotation at Spooner Physical Therapy would be February 17th, 2025 to May 9th, 2025. So to shift gears just a little bit, the first physical therapy related time I was given constructive feedback was when I worked at my very first outpatient clinic in Tucson, Arizona. I was working with a geriatric patient who was doing resistance band work, and she did not want to wear her gait belt. I did know that for the safety of the patient, it was a good idea for them to wear a gait belt, but also was told to listen to the patient, especially if they didn't feel comfortable doing something. Instead of grabbing a therapist at the time, because the clinic was pretty busy, I decided to help the patient by assisting the patient over to the bands and guarding them close by to assure there was no falling and to assure that the patient didn't lose balance. Soon after, a therapist did pull me aside and told me how important gait belts are for patients who are at fall risk, and I realized that, but our conversation was very useful and I did learn a lot from it. They basically told me to grab a therapist if a patient's ever uncomfortable with anything, and especially wearing a gait belt just because of the safety precautions. And they also helped me give more justifications on why a patient should wear gait belts in physical therapy and how I can instruct a patient and relay that information to the patient. But overall, it was a great learning lesson for me, and I will never forget to put a gait belt on a patient, or at least will better explain the importance of a gait belt in those populations. But overall, when it comes to my role in a team setting, I would say I am well organized, I'm encouraging, I'm detail oriented, trustworthy, and I provide positivity within groups of people. I love making sure that everyone involved is set up for success, while I also hold myself accountable and assure that I'm reaching success as well. But overall, just to sum this up a little bit, I do embrace and embody the Spooner Physical Therapy core values and previously have thrived in the Spooner Physical Therapy environment, working as a technician. I do believe that there are major benefits of treating patients and treating their entire body and encouraging movement among all patient populations. A clinical rotation with a specialty in pelvic health at Spooner Physical Therapy would mean the absolute world to me and would help me expand my toolkit and gain experience within my desired career path. So thank you for giving me this opportunity.